So good morning, Dr. Cesario. Can you tell me what is your title?
Hi, I'm Dr. Sandra Cesario, and I am the PhD and DNP Program Coordinator here at Texas Women's University in the College of Nursing in Houston.
Thank you. So describe your nursing work and your career thus far.
That's a very long time. I've been a nurse for about 40 years.
Wow.
And almost all the work I've done in clinical practice, in service, teaching, research has all been related to the health of women and newborns, often with a global component as well as marginalized women who and their newborns. For instance, women who are in jail for abandoning their newborn, or women who are HIV positive and would like to become pregnant. So marginalized populations, but those are often issues that are global in nature. It's not just what's happening in the U.S.
Right. So is that part of the reason what draw you to research, like to study the population more so you can be able to help them and help others understand how to translate whatever research findings you found into practice?
Yes, that's a big part of it. First of all, with a great clinical background that I've had the opportunity to work in a number of different states and a number of different settings and different roles, both rural and urban. I was seeing areas that, from different states, people do things differently in different settings. And just asking myself the question, well, what's the best way to do that?
Right.
So that led to some of my service work with A1, the Association of Women's Health, Obstetric and Neonatal Nurses, in writing evidence-based practice guidelines for things like the management of second-stage labor, regional anesthesia for OB patients, management of diabetes in the pregnant woman. So that really gets you into literature when you start looking at what is out there on that topic and rating that literature and taking the best available evidence and creating an evidence-based guideline. And then the next step of translating that into practice.
So how would you describe your leadership in nursing and the healthcare field?
Well, there's all different ways nurses can be leaders. I think simply being a teacher is a leader when you can enlighten people and support them on their own research trajectories. I've been a leader in different professional organizations, such as Texas Nurses Association, A1, a number of different things, and that leads the clinical bedside nurse, and also it helps impact policy and let the public know what you do.
Okay. What specific issues in nursing and healthcare does I guess your leadership address?
I think I ultimately would like to impact policy that improves the health of women and newborns. First of all, I think I'd like to say that nurses are scientists, and with this recent March for Science this past weekend, I think it was a great opportunity for nurses to inform the public first that they are scientists and what rigor their research has. So I think that's a really important piece, is that science piece that I don't think the general public recognizes what the profession can do for healthcare in general.
I see. So they asked about the gaps in the science that your research addressed, but I think that you just mentioned that.
Well, I think we can use the research better to inform, and oftentimes we have the information, but we don't take it the extra step to try to be on boards, to be, if that's a hospital, if that's a community group, if that's informing your politicians. I think nurses could do a better job in that. So I think there is a little bit of a gap there that nurses have just such a wealth of information that they could impact more if we unified and really got in the right position.
And I think I read recently where they're calling for more nurses to be part of boards, because a lot of what decision making that takes place really impact nurses, and we can do a better job at representing our community of nurses and being more just more hands-on and involved and part of that policy making. So
absolutely, and I think right now with our political environment discussing the Affordable Care Act, yes, there are some problems with it, and yes, things need to be addressed, but I think nurses aren't the resource that they're tapping into as much as they should, because we're the ones at the bedside. We're the ones teaching other nurses. We're in key roles, and I think we can inform them as they move forward in rewriting or changing, however they decide to do that, the Affordable Care Act, so that access to many of the marginalized populations that I have dealt with have access to care.
Right. Okay. What do you think will be better in nursing and healthcare because of science and leadership? And I think you just kind of touched on that. And,
well, hopefully access to care is a big one, and quality of care and consistent care. It shouldn't vary, based on your geographic location. Rural and urban patients should have the same access and standard or level of care. Just like the rich and the poor, or the different ethnic groups or religious groups, everyone should be very much the same. And
how does your science and leadership relate to local, state, and national policies currently?
Oh my goodness, in a lot of different ways. One of the projects that I have done with started almost 20 years ago now with Sheila Jackson Lee, looking at the problem of newborn abandonment, and to see how that information has been led us to safe haven legislation in almost every state. Texas was the first state to have any kind of safe haven laws, and the work that nurses in the state have done really did change policy, changed law. That was at the time when I was interviewing women in prison who had abandoned their babies and trying to find out what could we have done differently as healthcare providers to meet your needs so you didn't find yourself in this position. Mm-hmm. So it can make a huge impact that spread, in this case, nationwide.
Okay. Is there any other information you would like to provide regarding your program of research and scholarship?
Well, I think I'd like to make the point that we are living in a global society. We need to be global citizens and have a high quality of health care. We are global citizens, that it's our responsibility to look at the world, not simply our state or our nation, but with, is that the immigration issue? Is that health disparities related to cancer care? Violence against women is certainly a worldwide phenomenon, and we need to have a larger picture, not simply what do we do in our position, our job, or our city or state. How does that impact the world, and what can we learn from other countries?
And lastly, what advice do you have for the next generation of nursing leaders?
To be confident and go out there. I think that it's such a wonderful time to be a nurse and to become a nurse leader. I think the stage is set for us to move forward, to be recognized by the public, and contribute to improving the health of others. I think, like I said, we need to do that more. We have the knowledge, we have the experience. We just need the confidence to get on those boards and to go out there and change laws and policies and let the public know that what we do.
Definitely. Well, thank you, Dr. Cesario, for taking time out to interview.